Hi guys. Animals making noise as usual. Last video I put up, I was talking about your pets and some first aid. Just a reminder, get yourself some sort of pet first aid. This came from Red Cross. I have no idea when I bought it, or if I bought it, someone gave it to me. How long have I had it for? Ages. So I have no idea. But if you have pets, make sure you got a book and some supplies. Pretty much kind of almost the same things. People, some things are a little different, but have a pet first aid, have some sort of people first aid. Um, because you don't want to be trying to figure out what to do in an emergency when you're in the middle of an emergency. Um, you can get these. This happens to be the advanced life support, but they do make basic life support field guides. I'm assuming they still make them. I've had this for a long time, and this came from, I don't know if it's informedguides.com or if it's informed. It's INFORMEDGUIDES.com, informed.com. I happen to buy this at a EMS fire type uniform shop. They are kind of pricey, but they're good to have. I've never actually used mine, carried it around, but got a lot of good information in these things. If you just want something pocket sized, these things are great. EMS field guides. Okay. So, tools of the trade. First thing, if you can, go. Thrift shops are great. We happen to live where we have zillions of them. One thing I highly recommend if you're going to get a kit together, kids, go pick up. I think I spent $1 on this little guy. He's so cute. I like to keep him for my own collection, but paid $1. Get yourself a couple stuffed animals. Get a little kid who's really upset, and they will be. Best thing is give them a little stuffed animal, something to hang on to, and of course, be nice to them. But these are very helpful. And also, you want to have some gloves. They come in all types of colors: blue, purple, black. I happen to like the old latex gloves. These are the nitrils. I'm not really fond of them, but that's pretty much all you can find anymore. Um, Worst case scenario, if you go pick up a box of food service gloves, they're not very good. They're very, very thin plastic. You can always double glove, triple glove with those. Um, get yourself some gloves. And if you have different sizes, what I do is I need to put these into a different bag, but I just bag them up, and then you can mark bag. Probably a Ziploc. Probably what I'm going to do is switch these over into a Ziploc, but then you can just put, SM or L on the side of the Ziploc bag. That way you know what size gloves you're reaching for, because I use a medium, and my boyfriend obviously a large. So also, if you could pick these up, trauma shears, or regular bandage scissors, kind of interchangeable. I'm not really fond of these. I've usually found that after I cut one pair of clothing off, I have to go buy a new set because they just do not stay where they'll cut things. Bandage scissors seem to last forever. I can't find mine at the moment. They're here somewhere. And I would say at the very least, you want to get yourself, again, you can check thrift shops. A lot of times they have odds and ends of, first aid supplies, people that were being taken care of at home and they pass away, and, people donate the extra supplies. So always my go-to, 4x4s. These are 2x2s. You can get 2x2s, 3x3s, 3x4s, 4x4s. A 4x4 is a nice size for just about anything, and if need be, you could fold it down. Also, these are the 5x9 surgical dressings. These are a little thicker for maybe a deeper cut, something that's bleeding a little more. And this is Cling or just rolled gauze, depending. Cling is the brand name. I don't know how well you can see that. It's I have some that's open. They call it Cling because it sticks to itself. And it comes in a little roll, and just wrap that around. If you're in a bind and you don't have any tape, you just take the end and tuck it under, where you've wound it around. But if you can get your hands on some tape, this is the type I like. This is the sort of not really sure what it's called, nylon tape, or there's paper tape, which I hate. There's this type of tape, and there's another one that's like a heavier. I don't know how to describe it, but this is just the tape I've kind of always used. Doesn't really matter, just as long as it holds things. So if you get your hands on a couple rolls of tape, doesn't really size wise, doesn't matter if you want to get an assortment. If I find this pretty much works for everything. If you get the really thick tape, you can always tear it and cut it down to size, whatever. And very important. The reason I say the 4x4s are a go-to, if you have an eye injury, because your eyes move in unison, you don't want to just bandage one eye. I mean, this is a special oval eye pad. But, I have all this stuff, but you don't need this. What you can do is you can just take a 4x4 and you can fold it down to make an eye patch. And but you want to make sure you cover both eyes because the eyes move in unison. So if you have one injured eye, if the person's looking around with their good eye, you don't want the injured one moving around. So make sure you cover both eyes and either use some of this roller gauze or whatever you have handy. If you have some triangular bandages or cravats, you can also use these. Even just a bandana, any strip of fabric that you can tie around will work. You don't have to be all fancy. I just have all this stuff because I've been carrying kits around for years. This is the one I wear on my hip. Keeps my field guide, my scissors. I've got a pen in here. Keep extra gloves. I keep little notepads so I can jot down notes about the patients. Because I'm not real good about remembering all that stuff. Then I have my this is my grab quick, like we passed an accident or something. Keep my BP cuff. I have a splint in here, just that kind of the basics, at least to get started. And then I have another, which is like a big tackle box, which has all kinds of extra band-aids and bandages and tape and just about everything you could imagine. Then I have another really big bag, which is for things like this multi-trauma. These are great for obviously anything big or like an abdominal. If you have trying to put things in lay terms, so if you have someone with a really bad abdominal injury and like their intestines are out, okay, first of all, you don't want to cram them back in. and I'll go into that in a different thing, but that's kind of what something like this is for. And then once you bandage something like that, you want to put aluminum foil over it to keep the moisture in, keep it warm. Topic for another video, but these are very good. As it says, multi-trauma, kind of a one size fits all for a really big injury. Now, first thing you want to do is clean the wound, preferably if you have soap and water. Clean a cut or whatever, just plain old warm soapy water. If you have, I always carry sterile water around. Not everyone has this stuff with them, and this is probably way expired. Oh yeah, June of 15, but it's water. It's better than nothing. Even if you just have to put this on a gauze pad, and you just want to wipe, if like there's dirt or grit or anything in there, you don't want to get crazy, but you want to just try to clean it up as best you can. And then of course bandage it with whatever you feel is appropriate. Do not, whatever you do not take rubbing alcohol and pour that on a wound because it burns like crazy and there's no need for it. If you have some of this on hand, hydrogen peroxide, This is what you want to use if you have it for a wound. Um, just dampen up one of these 4x4s or whatever you have, um, and clean the wound up. Very good antiseptic. Everyone's going crazy for hand sanitizer right now. This is just as good, but I would not go and buy huge. Sorry, my cat is playing in a box beside me here. I wouldn't go getting like gallon bottles. I don't even know if they come in that size. I was watching a video a long time ago. Some guy was showing all these huge, monstrous bottles of peroxide he'd gotten, um, which is great if you're planning for a mass casualty incident or something. But once you open these bottles, make sure you keep track of the date, because once this is opened, it's only good for 30 to 45 days. You can still keep it. I mean, it's still liquid. You can still use it to have some liquid to clean something off. If someone falls, they have like little pebbles or whatever. You can rinse stuff out. It's just not going to have the antiseptic properties. But if you want to grab a couple bottles, small bottles of hydrogen peroxide. We happen to get this. We go to a discount grocery store. This is Degasa or something. I've never actually heard of this brand, and so I have no idea where you buy this. But I spent $1, but I think you can get it like at Walmart for like $1, and probably the dollar stores. Very good to have on hand. But just like I said, keep in mind that if the bottle's sealed, you're good. I think that will last for like a year or two. Not absolutely positive on that. But once it's opened, just keep in mind about a month or a month and a half or so, it's not going to have the antiseptic properties. Okay. What else do we have in a little bag of tricks? This isn't really bleeding related, but kind of a good thing to have if you can get your hands on one of these. It's an emergency blanket. It's basically kind of a big thing of foil kind of looking thing, because it helps retain the body heat. Even if it's relatively warm, if you have someone who's really injured, you want to make sure they don't get shocky, so you want to keep them warm. I mean, you don't want to cook them, obviously. If it's like 100 degrees out, you don't want to get them too warm, but you just want to make sure people retain their body heat. So it's something very good to have on hand. I've never actually had to use one, but when you work on an ambulance, you're there, you put them on the stretcher, you take them to the hospital, but we don't know what we're looking at right now. So, and if the hospitals get to the point or whatever, they say, we're not taking minor things, like I say, you might have to just kind of do the best you can at home. I mean, I'm hoping it doesn't come to that. And I'm in EMS. We have not been given any sort of special heads up. Basically, the same PPE or personal protective equipment we normally use, which is like a paper gown, mask usually with the eye shield or goggles, um, and obviously our gloves and stuff. But I mean, we have not, we haven't been issued like biohazard suits and all this stuff. And our medical director said if you have no underlying pulmonary issues like COPD or asthma, anything like that, emphysema, asthma, those sorts of things, chronic bronchitis, shouldn't really be an issue. So it's, even those of us out here in the medical world don't really know what's going on. So, I don't really know what to say about that. I'm just getting prepared for whatever comes down the pike. But, so those are your basics for bleeding control. Just to reiterate real quick, must have for kids, a little stuffy. Gloves. Get some gloves, a box of gloves. Probably be cheapest at like maybe a Walmart or something. They're hopefully not selling like toilet paper. But if you go to like a regular medical supply or whatever, you're probably gonna pay an arm and a leg for them. And also they do sell these, but then again, this is kind of, you can get your hands on stuff like this a lot more easily when you're running somewhere. 'Cause, there's extras, and you ask, of course, can I throw one of these in my personal kit? Or like I said, just a little aluminum blanket, emergency blanket, or just keep some blankets handy. you know. And also another must-have for anything would be a tarp. This is a 5x7, which is a good size. Um, if obviously if it's raining, if you have a couple people, you can kind of make a tent, keep the patient dry. Or if they can't really be moved very far, but they're laying in a bunch of muck and water, or it's cold or whatever, if you can, you might want to slide them out of that and put them on something dry, i.e. a tarp. And it's not a happy thought, but it is reality. It's also good for covering people. Or we go to accidents, we have to wait for a coroner, we cover things up. So prying eyes, have a little respect for the deceased, that they deserve respect too. So you want something where you can cover up a car or cover up a body, whatever. And most people probably aren't going to get these, and quite frankly, I don't even know where I got this. I've had this like forever. I take hospital ID bands, and I stick them around all my stuff if I can, put my name on there. And judging by how shriveled this is, I've probably had this for a really long time. It's a clamp. You get an arterial bleed, if it'll work, depending on the size of the artery. If you have something small and you can't get it stopped, if it's really laid open, you can clamp it. Just saying it is a measure you can take if you have the ability to have these, or someone that has these or whatever. But there's two types of bleeding. You'll have venous bleeding or arterial, and most people know this. But your venous is kind of like you're oozing blood, and your arterial will be spurting because it's being pumped by the heart. The venous blood is blood that's returning to the heart so it can get pumped into the lungs, pick up oxygen. And then the arterial blood is the blood that has gone into the lungs, picked up oxygen into the heart, and is now being pumped out to the rest of the body. So to actually control bleeding, now your arterial blood is going to be a little harder to control. And depending, if they have a huge gash, it may take a lot. Now, we were always taught way back in the day, put a bandage on, hold pressure, elevate. Excuse me. If someone is bleeding that badly, now our protocols are just kind of go right to a tourniquet, because you're going to go through a stack of whatever type of bandages you're using. And also, when you do bandage, okay, say this is your first bandage, you're putting it on the cut here. Okay, this is kind of hard here. You do not want to remove this, all right? And I've actually seen people in EMS do this. They want to see if they've stopped the bleeding. So what do? They pull it up and they take a peek. Well, then now you've just ripped off the platelets and everything else that's trying to clot the cut. So you never want to take the bandages off. If you see blood is seeping through that one, you just want to keep wearing, okay? Even if you have it taped on or whatever, just slap a couple more on there, tape them down, or have someone holding them, whatever is whatever's easier. But you never ever want to pull them off, because like I said, then you're right back where you started. Arterial is going to take a lot more pressure and more time to stop, because there's more pressure in the arteries, because it has to pump it out to the entire body, whereas the venous blood is just going back, taking a nice little happy ride back into the heart, so it can go out to the lungs, get oxygenated, and then it has to go out with more force to get out to the rest of the body. So I feel like I'm like really rushing. I'm trying not to make these too long. Was one other thing I wanted to mention here, and I'm not quite remembering what it was. If you do have a blood pressure cuff, or if you can get your hands on one, I bought a new one about 2 years ago. I don't really recall what I paid for it, but I'd say maybe they're like, I don't know, $20 maybe. I'm not really sure. I have a nice little happy floral, pretty one. I was looking right at him and said, "Well, where are the blood pressure cuffs?" She said, "Well, you're looking right at him. I'd never seen any except black and blue ones. That's all we ever carried, and fluorescent orange. And I didn't know they came in these nice little happy colors and flowers and everything. But you can also use that as a tourniquet. You pump it up just to the point where the blood ceases, and then you want to leave it there. Okay, and then I have one other trick. I forgot to have it in front of me. Sorry about that. Okay, well, this is also where thrift shops come in handy. If you have an old belt, great. If you don't, go to a thrift shop and you want to get yourself, if you preferably, this is actually a good duty belt. It's a nice thick leather. Take if you have a center punch, which is use these for breaking out windows. You do is you tape up the window with like duct tape. You stick this down in the corner of the window and just push on it and it'll shatter the window. And the reason you tape it is so that you can pull the whole thing out in a piece. It doesn't all crash in on your patient. But you can use this, or you can use this kind of a small tip screwdriver, like a Phillips head, works just fine. Anything round, just get yourself a hammer and put holes in it, just like the regular holes that are already in it. Just go the whole length. I know it's big, like my big fat waist, but just put holes in it as far up here as you want to where the buckle is. Then if you need to, this can go right around. You're going to put it on just like you would a belt. And, you know, wherever you need, whatever body part. Obviously, if you're going around a thigh, you're going to need more. And then if you have like zip ties, we went to Harbor Freight one time and we bought a whole pack of all different sized zip ties, and they are great to have on hand for just about anything, like a tarp. You know, if you need to put a tarp up and you need to secure it, you can put a zip tie through the grommets and you can tie it to something. But and I'm squeezing my arm here as I'm speaking, but just cinch this up, put a zip tie through it to hold it in place. You don't want to loosen these. Okay, once you stop the bleeding, but you only want to cinch it up to where the bleeding stops. Once you stop the bleeding, do not keep pulling tighter on it. And one of the tenets of first aid, you know, EMS, it's life over limb. Okay, so if someone has to sacrifice a limb to keep their life, sad fact of life, but it's always life over limb. So you might be thinking, oh my God, you know, this person's going to lose their arm or leg or whatever. Well, if you're saving their life, that's what you have to do. So I'm hoping it's a little disorganized here, and I laid everything out around me here so I see it. If I have a visual, then I go, oh, okay, I didn't forget anything. But you know, we're living in crazy times. I don't know what's going to be going on. I don't know how much time we're all going to have to be going out and gathering up supplies. But you know, if you can, at least get your hands on. If nothing else, I would say get some 4x4s, because like I said, these are great. They can just be folded over. They can be used as eye patches. Kind of a one size fits all. And if you can, either get the 5x9s, the thicker ones, or if you can get like one or two of the big trauma dressings, that should kind of be pretty good for just about anything. And obviously band-aids and all that kind of stuff. But hopefully that's a little primer on just basic bleeding. You know, and if someone does have venous bleeding, a lot of people have the misconception that you can only bleed to death from arterial bleeding, and that's not true. You know, if you have a big enough cut through veins and they're bleeding profusely, yes, you can bleed to death from venous loss. It's not just the arteries. So any bleeding, you want to get it stopped. If it's something small, you put pressure and elevate, you should be good. Tape down the bandage, but like I said, do not remove it. Just keep adding more and more. never take them off. If you can't get to a hospital, you want to check it, maybe a day. Take the bandages off, clean it up again, rebandage it, keep it covered. You can use a topical antibacterial if you want. I'm not real fond of those things, but I'm a real fan of soap and water, or even just some of this. But that's pretty much it. And my dog wants to go out now, so hopefully hopefully that helped with basic bleeding. And I'm going to try to do like some more on breakdowns, different aspects of first aid care, and hopefully that helps someone if you get into a situation, you'll know how to handle it. But the best thing is get yourself some first aid books. At least that way you have a reference. If you're prone to getting all excited or panicky, you're not going to be able to think clearly. So if you have something to refer to, that helps. Okay, thanks guys. I'll see you soon.